Hello, everyone. So, can you see, we have old players, old winners, just
Yeah,
here.
many names sound very familiar.
Right,
Malcolm was the winner of the first quiz.
right,
We also had Tanya, who was, I think, second place in the last quiz.
right.
Hemant. It is good that more and more people are showing their willingness for the
Right.
quiz.
Yes, it's very intriguing.
Welcome to JuxtaMed quiz. This is the fourth session in the row, and today we are here with the topic hematology images. Myself, Dr. RMD, and my team, Dr. Rupal and Dr. Manoj. Here we are to conduct the fourth session of hematology, that is hematology images, one of the very important topic for PYQs in NEET-PG and INI-CET. So, Dr. Rupal and Dr. Manoj will be going ahead with this quiz, and then we'll be having a short prize distribution ceremony, followed by recap of what are the topics we have discussed in this quiz. So, we hope you'll be enjoying this quiz, and we'll be starting this quiz in a short while. Over to you, Dr. Rupal and Dr. Manoj.
Thank you, sir. I think everyone is quite
Thank
excited.
you, sir. Yeah, I guess we have many old players also. I think this quiz is of some use to them.
It does, it does. As
And please give your feedback, guys.
we would love to hear what do you have to say about the whole quiz and how everything is.
Here is your first question. So, you
Match.
need, yeah, go ahead.
Yeah. So it's basically match the following. These are your basic questions. I hope you know what the basophil and a monocyte is because it's like one of those questions that can make or break things because these help you to diagnose it. So let's see. What is it? Oh.
Majority have answered it right. 13 of them have got it right.
Mhm.
Here is the leaderboard. Ashish is at first place, followed by Malcolm, Arna, and Tanya Hemant.
Wonderful.
Yeah. So let's
Let
move on to the next question.
I
Don't
think
lose
this
hope,
is
guys.
a yes, sir. I think this is a good warm-up question, sir, for them.
Yeah, right.
let's get going. Question two. Which is it?
This is again a match the following. The reason why we have put these questions is because these type of questions form the base for many other questions.
That is definitely true. Knowing these basics, they help us to diagnose so many diseases.
Everyone has got it right. Wow.
Wonderful.
Let's see the leaderboard.
Oof, it's changed.
We have Malcolm.
Malcolm is leading with 161 points, with followed by Ashish. And you see, Tanya and Anna both are at third position, followed by Shanmuga Priyan.
Wow. The guys are going very competitive. Good
Yeah.
going, guys. Good.
Yeah.
So let's move on to some tough questions. Let's move on to question number 3.
Well, we don't know if it's going to be tough or not. So, what do you think? Is it tough?
I think this is tough for
I
a
think
second
it
year student.
depends.
Two sides of
Yeah.
medical education. One, I think it's all about one finds it hard, one finds it easy. So let's see how are people doing in this.
I guess this is a pretty good clinical question.
Hmm.
And
Ooh.
say I said you, this is a tough question.
Oh, yeah.
So I think now the leaderboard is going to change a lot.
Yeah,
Oof.
yes, sir. We'll have new players, I guess. New players coming
All
up.
right.
Oh, so
Oh,
we
we
have
have
Mukul
Mukul
Kumar
Kumar.
and Hemant both competing for the first place.
Damn.
Just imagine the level of competition. Followed by Malcolm, Ashish,
Mhm.
Tanya, Arna, Shanmugapriyan, Tamzil, Sharanu, and Ibrahim Khan.
Mhm.
So these are the 10 people in the top 10 leaderboard.
Mukul was very on point. He got the hard one correct. So did Malcolm.
Let's
Guys,
see
come.
who gets this. I think this might be a confusing one. I don't know if it's true. What do you think?
I think if you know something known as fat cell ratio, I think you can do.
Yeah.
What do
And
you
these type of questions are exactly asked in INI-CET, where two options are very confusing.
think? Confusing, that's true.
Mhm.
Woohoo!
11 of them have got it right.
That is good. Who is it now?
Oh,
Hemant.
Okay, it's
so
Hemant.
Hemant is at top position, followed by Arna at second, Mukul Kumar at third.
And sir, can you notice Hemant is like going in a streak, 4 questions in a row.
Wow, that's very impressive. Nice.
Very
I think
good.
I
Hemant
think
has
he's
a
the only
solid base
person
in
with
Hemant, sir.
he's the only person with four streak right now.
Wow. Nice. What is going to be the fifth question? Okay, I'll read it out. A young patient complains of shortness of breath and occasional hematuria. USG scan shows shrunken spleen. What is the defect seen here?
This is a pretty much clinical question. I guess when we see patients on wards in the wards during clinical rounds, we come across this type of a scenario.
Yes, that is true.
Yes, sir.
Whoa.
So what is a
Most
defect?
of them
Nice
have got it
question.
right.
It's nice question.
Hmm.
So let's see.
Damn.
Hemant is rolling.
I think Hemant has a solid base, sir, here.
Yeah, I guess he has come prepared.
Come prepared. Hmm. I
Okay,
guess.
let's move on to the next one.
Guys, guys.
I
This is
think this might be easy.
yeah, this is easy peasy.
I haven't reviewed pathology for last 2 to 3 years, but I think I know the answer.
Hmm.
Okay, we need some easy questions in between too, right?
Hmm.
We are just playing how the NEET and other competitive exam places. Hard, tricky, easy.
We have a new player among us, and he's Nirmal, who is right now in the third position. So right now we have Hemant, followed by Ashish, Nirmal. At fourth place we have Mukul, and at fifth place we have Malcolm.
Ooh,
Many more questions, guys. So uh, be on track. So let's move on to the next question.
this is okay. I can give you an hint if you guys would like to know. So you can see this triad is seen in mesenteric ischemia and also in DVT. So it covers, a little bit of surgery topic as well. Let's see who gets it. Hmm.
Most of them have got it right.
Hmm.
That
This is
means the
a
level of
trick they play,
competition
I
for
think, sir.
upcoming NEET-PG is going to be hard because of JuxtaMed quiz.
I am betting on it now.
Okay, so Mukul is at his seventh streak, but still he is lagging behind. I think Ashish and Hemant have answered the questions quickly. They have
Hmm.
taken less time to answer the questions. That's why they have got extra bonus points.
Points, yeah.
So right now we have Ashish at first place, followed by Hemant and then Mukul.
Hmm.
So
I
this
think this
previous question
question is
was
a
virtual
perfect
stride,
example,
right?
sir.
Yes, yes.
Okay.
Yes, sir.
Okay. Let's see if you guys can, spot the abnormality.
I think the worst option in this is normal smear. It's like cheating a normal smear from an abnormal one. I think that is the toughest option.
We've said enough. Hmm.
Okay.
This is actually a nice question, sir.
Yes.
Yeah. So still six of them thought it was pyrocytosis. If
Hmm.
we had included iron deficiency, I think many people would have marked iron deficiency.
Hmm.
That confusing it gets.
Okay, so right now we have Hemant at first place, followed by Ashish and Arna, and Tanya is in the longest streak right now with four correct answers in a row. Okay,
Whoa.
two more questions, right?
Yes.
Okay.
Yes, sir. Two more. I think 11th one is just a no point question, sir. It's just a
Yeah.
review.
What do you think?
This is a riddle.
Yes.
Yeah.
Without me, you will die of bleeding. I am the frontline warrior who will be required first. Who am I? Let's see who gets it.
Okay,
Ooh.
what is this regarding? I have no idea. I think I need to watch recap to refresh my knowledge. I really have no idea what this is regarding.
Ah,
Okay, so those who haven't understood, kindly wait for the recap. It will be there after the quiz. And here we are at the last question. Okay, right now we have Hemant, followed by Ashish and Arna. And we'll have one last question. Okay, so are you guys ready?
I think they are. Guys, I hope you have watched this TV series. I hope you know who's Will Smith.
To be honest, I haven't. I guess I need to watch this.
Yes, it's. uh,
Okay, I think the image gave the answer and
I think we
also
had two hints also, sir, here.
imatinib and the image.
Yeah.
yeah.
Good. So let's review the final leaderboard. Hemant, good. One
Okay.
more quick question for you guys. So this is nothing related to points, but how fast you click on the answer. So here we go.
No, no, sir. The points won't count. You guys
Okay,
can take
so this is the final
time.
leaderboard, right?
Yeah, yeah. This is the finals.
Okay, so this is the final leaderboard, and we have Hemant who is at first place. We have second Arna who is at second place, and third we have Ashish who is at third place. Congratulations. At
Congratulations,
fourth
guys.
place,
Congratulations, guys.
we have Tanya, fifth place Mukul, sixth place Tamzil, seventh we have Nirmal, eighth we have Malcolm, ninth we have Soumya, and tenth we have Sharno. Great, guys. So last, let's get a quick review of what your experience was.
No bonus points, guys. But please tell us. Please tell us how do you like it? Hmm. You can leave us comments also if you like. Let us know what would you like to do. in the next topics as well. We are open to your suggestions.
Yes, guys. Yeah.
Awesome. Nice. Okay, so this
Well,
was
I
the final leaderboard.
Mhm.
So we have Hemant, Ashish, and Arna, right?
Anna
Okay.
Yes. Yes.
had the longest rocking streak.
Wait. Sorry, I think okay, yeah. So we had this Hemant, Arna, and Ashish. Yeah, these three people. These are the final winners.
The drum rolls don't stop for you guys.
Okay, so now we'll be having a discussion session on this. So over to you, Dr. Manoj.
Yes,
We'll be
sir.
also having a prize distribution ceremony of JuxtaMed quiz session 2 and session 3. So in JuxtaMed session 2 and session 3, which was conducted a few days back, we had session 2 with RBC disorders, and session 3 we had WBC disorders. So we'll be having a prize distribution ceremony now. So winner of JuxtaMed quiz session 2, sorry, session 3, that is the WBC quiz, which was held on October 31st. The winner is Dr. Rutala Vamshi. Congratulations, Dr. Rutala Vamshi. You will be also getting an Amazon coupon voucher. Okay, it's a cash prize for being the winner of this quiz. Congrats.
Congratulations.
Congrats, Vamshi.
We also have winner of quiz session 2, that is RBC disorders. Next slide.
Yes, sir.
Dr. Charan, who has won the session 2, that is RBC quiz, RBC disorders on October 29th. So he'll also be getting an Amazon Cooper voucher for as a cash prize for being a winner. So congratulations, Dr. Charan.
Congratulations.
Congrats.
So this quiz winner that is Dr. Hemant, right? So Hemant will be getting a prize in the next session.
See, guys, if you win, I think you would like your photos to be recognized. Everyone wants to be recognized. So if you would like to be one of those, you can always send your pictures and be the winner. But you have to be the winner first. All right.
In the same quiz, we had other winners, that is Dr. Ashish and Dr. Malcolm, who were winners of WBC disorders quiz on October 31st. And on October 29th, we had RBC quiz, RBC disorders, in which we had second place, which was taken up by dummy account. We really don't know who this guy is. And third place by Tanya. So congratulations, guys. So now we'll be quickly moving up to
Congratulations.
for the review of today's quiz, that is today's hematology images. We'll be going up for review recap. So over to you, Dr. Rupal and Dr. Manoj.
Yes, sir.
Okay. So over here, as you see, we are explaining you a little bit, not in the explanation, but a little bit more idea about the questions that we had made for you for today's quiz. So in the first one, we asked you a little basics. So please understand, basic means if you know all of this and how their normal states are, you will be easily able to differentiate between a normal and an abnormal slide. Okay. And let me just tell you over here, there are like few basic facts. Like neutrophils, neutrophils are basically 3 to 5 lobed nuclei, and they are the first one to respond to bacteria or a virus. Eosinophils are brick red granules, okay, and they have a bilobed nucleus. They are also known for their role in allergy symptoms. When it comes to basophil, they are dark blue granules, and they have an obscuring the nucleus. Okay, and they are also known for their role in the asthma. Let's come to the lymphocytes. Lymphocytes have simple nucleus with no granules, and they fight infections by producing antibodies. For the monocytes, they have no granule and have a reniform nucleus. They help in cleaning up the dead cells. The next slide.
Okay, there was a question that said a female patient on methotrexate complains of fatigue and weakness. So, as we all know, methotrexate is a folate antagonist. Hence, there is decrease in folic levels in the body, leading to macrocytic anemia. So, here the examiner is testing on the levels of differentiation between vitamin B12 and folic acid anemia. Hence, the answer for this question is increased homocysteine levels and normal methyl malonic acid, nothing but a folic acid deficiency. Whereas if it was a vitamin B12 deficiency, it would be increase in homocysteine, normal methyl malonic acid levels. Also, if we go one step further, because of this high homocysteine levels, it will lead to a thrombosis formation, and question can also have atherosclerotic symptoms. So you might be confused based on this, and this trick can be played by the examiner. So we always need to be alert. And one good hint was the pair of hypercented neutrophil, which is nothing but a folic acid deficiency. We'll move on to the next question.
Okay. So guys, over here you can see this is the bone marrow smell. Okay, so over here you can simply differentiate the fat is to the cell ratio. In the first slide, you can see it is equal. Okay, the fats and the cells are all equal. And in the second one, over here you can see the fat cells have more, have like increase as to the number of the cells. So it is also known as a fatty marrow. And where can you see? You can see it in pancytopenia, parvo B19, HIV, and toxins. Okay, and when you come to the third slide, there is like a huge amount of fibrosis, and where you can see these fibroses are myelofibrosis, which is JAG2 mutation, uh, then MPL mutation. It is also seen in hairy cell leukemia, where you can see BARF mutation and egg tumor cells. Over to you, Dr. Manoj.
I would like to add a point. Uh, the examiner's favorite out of these three is pancytopenia induced by these viruses. The reason for this is because in clinical practice, we'll be seeing so many cases of pancytopenia, especially in children. And the most common cause for this is following a viral prodrome. So you'll always be getting a question if not on if on pancytopenia will be related most of the times to viruses rather than tumors, because in pediatric age group viral induced pancytopenia is much more common rather than pancytopenia induced by other causes. Okay, so keep this in mind whenever you're attempting next NEET-PG and INI questions.
Thank you.
Okay, and there was a question that said patient has shortness of and occasional hematuria. So the diagnosis is sickle cell anemia. As you all know, this is due to sickling and desickling phenomenon. And the main defect here is in the sixth position of beta globin chain, the normal glutamic acid is replaced by valine. So due to this, there is a sickle cell formation uh, tendency leading to sickling and desickling stage. This sickling happens whenever there is a deoxygenated state in the blood. So due to this, there are two outcomes. One, there is a cell damage, and the other thing is vaso-occlusive symptoms. As you all know, due to cell damage, it leads to hemolysis and hence anemia. Due to vaso-occlusion, we see symptoms like pain crisis, dactylitis, shrunken spleen, and shortness of breath. And also, the investigation of choice for this condition is sodium metabisulfite screening. sorry, and or else we can go with the hemoglobin electrophoresis, which show increased HbF level. The treatment here includes use of hydroxyurea, which increases the HbF levels, or we can use oxalator, which was a PYQ question, I guess, which this drug actually helps to maintain the RBC in the oxygenated form, hence preventing the deoxygenated state.
I would like to add two more sentences regarding sickle cell anemia. Actually, what we see in theoretical way is that patient will come to you with anemia, and then when you see sickling, it actually doesn't happen that way. Most of the time, this patient come with random symptoms. Okay, they'll just come with chest pain, they'll come with pain abdomen, and as a resident or maybe as an intern, you'd think that this child or this even adults, okay, this child has come with some vague symptoms which are like gastritis or maybe because of constipation or maybe some chest pain because of maybe psychological causes. Okay, because we get many cases where psychogenic causes of chest pain are also there, psychogenic abdominal pain is also there, so you tend to overlook these cases. But when you actually that is the importance of clinical skills. Okay, when you see other symptoms, when you start seeing at USG where you can see atrophied spleen or there is decreased spleen size, so that time you'll notice that there is something which is not fitting properly in this one in this picture. So that time when you do usually when you do this peripheral smear, you won't find. Okay, so that's when we induce sickling. Okay, when you induce sickling using sodium metabisulfite, so that time you'll start seeing the sickling. Okay, and then you start thinking about sickle cell disease. So many of the times I have seen people have missed cases of sickle cell anemia because they don't suspect this disease. It is very it is a mimicker. Okay, it mimics many other conditions.
Hmm. That's a quite clinical intake from your side, sir. Thank you for letting us know. Okay, so over here we have the next question. See, I think pathologists want to associate things with things, you know. They like animals, they like food. So here you can just remember it like that. Uh, Owl-eye appearance is seen in Hodgkin's lymphoma. Okay. And when you see in the second slide, you see Burkitt's lymphoma. So Burkitt's lymphoma gives a very starry sky appearance, and it is due to the apoptotic debris and numerous macrophages. Okay. So basically what happens is tumor cells are medium sized. Okay. And they are round. They have very minimal cytoplasm. So because of this, they are very close to each other, and because of the closeness and minimal cytoplasm, they give a blue background that is known as starry sky appearance. For the owl eye appearance, you can see like in the Hodgkin's lymphoma, it is right now it is shown in a small, right? So over here, when you see when you have a slide of CMV inclusion bodies, so over there you can see in zoomed manner that is the owl eye appearance. Okay, Dr. Manoj. Let's go, Dr. Manoj.
Yeah, I think Rupal, you can take this question. I'll take the next.
All right, sure. Okay. So, guys, as we discussed and told you before, basics are required. How do you know it's basic? When um, all of the platelets and the cells, you know, they are present in the correct quantities, and they have like normal size and color and shape. So on your left side, you can see the normal smear. And if it is reticulocytes, you can see the nuclear material is present. It is in dark, or sorry, the bluish appearance, right? Where you can see over here. So it can be seen from normal to all kinds of RBCs. Okay. Over to you, Dr. Manoj.
Yeah, yeah. And this is our second question. We had for this question, the answer was GP1B, 2B, and 3A molecules. These are nothing but the molecules which are present on the platelets, which help in platelet accumulation. So here, these three molecules play a very important role without which platelets do not function. So the very step here is the 1 millibrand factor is given out by the endothelium to which the GP1B on the platelet comes and bind to it. And the second step is the GP2 and 3A, which is present on the platelets, is exposed by the help of ADP, that is adenosine dephosphate. And now all the platelets nearby bind to this GP2B and 3A molecules, hence leading to a primary platelet plug formation. This takes place with the help of thrombin as well. If there's a GP1B is defective, it is termed as Burnout-Solier syndrome. If GP2B or 3 is defective, it is known as Gleason thrombasthenia. The answer for this question is okay. This is the basic mechanism by which we see primary platelet plug formation. And yeah, and last question, which where we had was Philadelphia chromosome, which is seen in chronic myeloid leukemia. The hint was one is slow progression, which mainly indicated chronic state, and the other hint was imatinib drug, which is a tyrosine kinase inhibitor, which is used in CML condition. And yeah, and these were the short recap of the questions. Thank you for being a participant of this, and see you all in the next session. Thank you.
Thank you, everyone. But we have more for you guys. So just hold on. This is our explanation due for you.
Opened our social media accounts for JuxtaMed quiz on various platforms. On Instagram, we have a page called JuxtaMed quiz, where we will be sharing you in detail regarding the quiz sessions about what we have discussed so far and important things, PYQs, which are asked along with winners details also. So you can follow us on Instagram. Along with that, we also have a Twitter account, that is X account. And along with that, we also have a new YouTube page on JuxtaMed quiz. The name is JuxtaMed quiz for NEET-PG bar INI-CET. So link for all this will be shared as Linktree using Linktree, and that link will be updated in the Telegram WhatsApp channel and also in the new our YouTube channel, that is JuxtaMed quiz. So hereafter we'll be trying to conduct these sessions on JuxtaMed quiz YouTube channel, which we have a separate YouTube channel for JuxtaMed quiz only. So hereafter we'll be planning to conduct these sessions on that channel itself. Okay. So we hope you had a very good participation now. We also hope we'll be having a very good participation in the coming days. So I guess you get a lot of studying to do just by attending this quiz and having a quick recap. So all these questions are framed based on PYQs and important topics which are going to be asked very frequently. So this is like an entertainment session. Take out few minutes in a week, in a day, to attempt this quiz and study for this quiz. This will be a very good revision for you guys. So we'll be in constant touch with you for next topic. Keep updated in the Telegram group as well as WhatsApp channel. So till then, bye.
Yes, guys. Thank you so much. Followers, subscribers, click the bell icon. All right.
Thank you, guys. Thank you so much.